NCLEX is changing in 60 days, and today we're going to look at the clinical judgment measurement model, particularly layer 3, where our case study questions will be coming from. Let's take a look at this chart. Okay, so there's 6 case study questions, and each question will come from a step of the clinical judgment measurement model. So let's look at step 1, for example. It says to recognize cues. As a nurse, are you able to recognize the signs and symptoms of different diseases? That's what you're going to have to do for case study question 1. So for example, dehydration. Step 2 says analyze cues. So that means based off of what you got from the first question, can you describe the relationship of these things? Do you have a direction that you're going to in your mind of what your patient could be dealing with? So step 1 and step 2 really work together in terms of formulating the issue that is your priority. You're always moving towards step 6, which is evaluation, right? So these are the things that you will be expected to do. Step 3 we see here is prioritizing your hypothesis. So if you've gathered clues and you've analyzed them, now do you have the capacity to pick the priority from everything that's going on? Step 4 is after you've prioritized the thought of what's happening, can you generate solutions? Do you know the treatments for that particular issue? And then step 5 says to take action. So are you able to know how to administer a medication? Do you know the teaching? Do you know the vital signs that need to be taken before that medication is given? Do you know if you can even give that medication if you're a practical nurse or a registered nurse? And so by the time you get to that 6th clinical judgment measurement model step, evaluating outcomes, you're at the point that you've moved through a clinical situation, and now you are supposed to examine, did I do what I was supposed to do? Are these outcomes that I'm presented with within an expected and normal outcome? Are the vital signs now normal? Is the blood glucose level normal now? Is the patient experiencing less confusion? So when we talk about the clinical judgment measurement model, layer 3 is going to be so important for you to sit down and study and go through case studies that are addressing each one of these steps, because you need to be able as a nurse to be competent in the totality of patient care. It's not just about you picking out signs and symptoms, but can you generate solutions? Can you prioritize? Can you pick the appropriate actions? And so this is why during the countdown, I wanted to specifically look at layer 3. I hope this helped you. I'll see you tomorrow for more.